Welcome to the Spine Institute of Southern New Jersey, located in Marlton, New Jersey. The Spine Institute was established in 2001 by Dr. Joan O'Shea. Dually trained in neurosurgery and orthopedic spine surgery, Dr. O'Shea is a board-certified neurosurgeon with additional fellowship training in orthopedic spine surgery. Dr. O'Shea developed and implemented a comprehensive spine specialty program for patients suffering from severe back and neck pain, providing an individualized, minimally invasive surgical experience. In 2005, Dr. O'Shea opened the first outpatient spine surgical center in South Jersey. The South Jersey Surgical Center, conveniently located in Mount Laurel, is a comfortable, state-of-the-art facility where patients in need of spine, neck, and back procedures, including anterior disc replacements and minimally invasive fusions, are cared for and receive the highest quality of treatment in a patient-oriented surgical center.
The healing time for a minimally invasive surgery is much faster than if you have an open procedure.
The Spine Institute of Southern New Jersey and the South Jersey Surgical Center continue to grow and serve patients in providing the highest level of spine care in the Mid-Atlantic area.
I'm a New Yorker, born and raised in Manhattan actually. I went to State University of New York in Binghamton for college, went on to medical school in Syracuse, and then was fortunate enough to do my neurosurgery training at Mount Sinai Medical Center in New York City. At that time, I realized I really wanted to dedicate my practice and myself to spine, and I did 2 orthopedic spine fellowships under the guidance of Dr. Michael Neuwirth, who is Gloria Estefan's surgeon. And that was at NYU's Hospital for Joint Disease and the Beth Israel Spine Institute. I was fortunate enough to find a place like Southern New Jersey that was close enough to my home in New York, but yet an area that didn't really have surgeons doing complicated spine surgery, and I was able to develop a practice here over the years.
An enduring part of Dr. O'Shea's philosophy centers around the concept that she has patience with her patients. The Spine Institute of Southern New Jersey treats everyone as if they were relatives, uniquely tailoring each patient's care based on their diagnosis, condition, and personal needs. Dr. O'Shea and her staff listen to their patients and offer the most conservative treatment options.
Most problems that people have with their neck, middle, and lower back are due to non-emergent situations, so that they can be treated conservatively and often don't require surgery.
Dr. O'Shea will typically not perform surgery the first time around because she will try other avenues to get the patients better.
I know as a physician referring patients to Dr. O'Shea that she uses a more conservative approach. Her first line of treatment is not invasive surgical procedures. Her first line of treatment is to use a more of a holistic approach, utilizing physical therapy, possible referral to pain management for interventional procedures, more conservative things before she will even contemplate performing a surgical procedure.
This level of care, along with the culmination of many years of education and experience in the specialty of spine health, contribute towards building the cornerstone of the Spine Institute of Southern New Jersey philosophy.
Many people that come to my office ask if I can do their surgery minimally invasively. And usually the answer is yes. I'm able to get plates, screws, cages, artificial discs in through an incision that's maybe that big. In the lower back now, we have advanced the field, and I have taken the time to learn how to do these things. Not every surgeon knows how, even the ones coming out of training right now, but we do very small incisions off the midline of the spine that preserves all the musculature and most of the bones on the spine, and we're able to put instrumentation where we have screws, rods, cages into the spine when necessary, and do this through tiny incisions. This definitely helps the patient in their recovery. There's lower infection rates, and of course less blood loss, and quicker time to recover, back to work and play.
I'm a cricketer, and I'm also a vocalist in a reggae band. So, you know, it really hampers me. It was hampering me before my neck. And since I had the surgery, I'm telling you, man, it's amazing.
I used to have really bad headaches, and I never put 2 and 2 together, but immediately after the surgery, I didn't have the headaches. It was phenomenal.
They saved my life, the Spine Institute. They performed surgery on my back. I was paralyzed 15 years ago, and now I'm walking, so they helped me greatly. They saved my life.
Dr. O'Shea and her staff of highly experienced healthcare professionals believe in a conservative approach. Surgery is prescribed only when absolutely necessary. This combination of extensive diagnostic testing, non-surgical options, and if needed, state-of-the-art technology in spine surgery all adds up to the best possible outcome for Dr. O'Shea's patients.
There are really not a whole lot of surgeons in the state who I refer patients to. I have several different offices around, but Dr. O'Shea I send patients to without hesitation, and patients will ask you this, well, would you go there? Would you send your family there? And the answer is yes, I would.